I think one of the main things that you need to consider is finance. If it looks like there's a slight possibility that you can't afford it, get yourself in a better financial situation before you start the course. That's something that's really affected me. Another thing that I would say is support. Make sure that you've got some kind of emotional support, not just financial, but that you've got a group of people around you that you can ring up and just have a cry down the phone to at times.
You really, really have to be passionate about the job, nursing or midwifery, definitely. Because, again, it's difficult. If you're facing all these challenges at the university and life throws you in, it's like, oh, I don't really know whether I want to do it or not, then those are the kind of students that tend to drop out. But if you really go for it, if you really want to do it, if you're that determined, I think you will succeed, definitely.
It's a decision that cannot be taken lightly, and I can't emphasise that enough. There are a lot of factors you've got to consider: your family, your finances, your living circumstances. Are you committed 100% to studying and working back-to-back shifts, different placement areas, fitting in with different personalities? You've got to be strong. You've got to be 100% committed.
I would say if you can get any experience beforehand, even if it's voluntary work in your local hospice or something, that would be a good thing to have. I think probably it sets you in good stead if you are keen on learning and studying, which I am, terminally nosy. So the idea of always wanting to learn and find out more will set you in good stead. And to a certain extent, a disciplined attitude. If you're going to do it, it's going to be hard work, but it's going to be worth it.
You need to find out that if it's the course for you. You need, if possible, spend some time either with a midwife or a student midwife. Find out if it is in what you need to do. Go along to the university, speak to the admissions tutors, find out how the course works and how it's going to fit in with your lifestyle. If you have commitments outside of the university, are you going to be able to do that? Are you going to be able to give the course the 100% that it requires, and are you going to be able to juggle your family life, social life, whatever it is that you want to do outside those hours, and read up really, make sure that it's what you want to do.
I'd say they need to be adaptable. So for those that have got children, they need to know that the shift work will disrupt them a little bit. They won't be able to do things with their kids they might have done before maybe. Planning ahead, making self timetables or lists of things to do is a good way of managing yourself really.
And you've got to make the best use of your lecturers, and because everyone's there to support you really and help you, so and I think that helps you mainly to get through your course. And that
the important thing if you decide to do a nursing career is do your research, make sure you can afford to do it, make sure it's what you want to do, make sure you do the right branch, seek advice. Speak to your parents, speak to family, speak to friends. Most of all, make sure it's what you want to do.
And if things get too tricky and you feel as if you're sinking, there's university mechanisms. You've got your personal tutor, you've got your placement manager, you've got your year leader, you've got head of School of Health. There's so many mechanisms in place that this course, you can succeed on this course.
You've got to be prepared to work hard, but at the same time, I think when you go home from placement and all you think, you go to placement some days and you come home, you think, wow, I've done really nice things today. It's worth it then.
I'd say go for it. It's good, it's rewarding, it's good fun, you meet lots of new people, meet lots of friendly people, and there's loads of support out there, so you don't need to worry about being hung up to dry, because it doesn't happen. There's loads of people to help you.
It's a fantastic course. I would recommend, if you feel that you've got the calling for nursing, that you should definitely look into it and definitely pursue it. It's fantastic. I love it.